rules and do a few things. And MJ has started the recording, so I want to welcome everyone here to our Better with Beef Happy Hour producer education series here tonight. I'm your host, Travis Taylor. I'm the CSU Golden Plains Livestock Extension Agent. And we at Colorado State University Extension are happy that you joined us to continue over this next couple of weeks with our series, Happy Hour series at Thursdays at 5:30. We hope you find the information educational and timely on our beef production topics. MJ Fisher, I want to thank him. He's the regional director in the Central Region, CSU's Central Region, and his office is out of Pueblo, Colorado. He really inspired me to help put this together. Thanks to Christine Poletich, who does the registration for us out of his office down there. And special thanks to Lacey Taylor, the extension agent in the Southeast area, for helping me develop some of the advertising for this event. I'd like to thank our sponsor in particular, and that, if you can see my screen up there, is the Western Sare for their support for this event. And likewise, Colorado Livestock Association, the Colorado Cattlemen's Association, and the Colorado Beef Quality Assurance Program for helping advertise and promote this event. Finally, I hope some of you were able to prepare the mini citrus taco recipe that we had on the invite and have paired that with your favorite beverage for tonight's happy hour event. A few ground rules I want you to keep in mind: that we're going to ask everybody to mute themselves and put questions in the chat function of Zoom. If you're on the phone, we'll give you some time at the end, but we're going to try to hold all of our questions towards the end of this presentation. And with that said, it's time to introduce tonight's speaker, and that is Dr. Tim Holt, DVM. He's an associate professor in the Department of Clinical Sciences at Colorado State University, earning his DVM from Colorado State in 1998. Most of you know he's widely known for his research with high mountain disease in bovine, which causes congestive heart failure, and the development of the PAP test. However, a lot of you don't know he was a practicing veterinarian in the Gunnison Valley in Colorado for 19 years. He's the recipient of the 2013 Colorado Veterinary Medical Association Distinguished Service Award, and he's a certified veterinary acupuncturist and manual therapist. I'd like to turn this platform over to you, Dr. Holt. Thank you for being with us this evening.
Thank you, Jeff, and thanks everybody. This is a whole for me, and I've got to talk to. I look out there, I say, to be honest with you, I don't really know what I'm doing here. I'm talking to a computer. So brace yourself or whatever. I'll try to speak slower than I normally do. I'll try to keep out of the echoes and things, but I brought something special for you tonight because it is the happy hour. So I'm going to pull this out here and show you a couple things that I do at my happy hour. And what I do, and these are like recipes, and this right here is Welch's grape juice. This is like my favorite thing. I've been doing this since I was about 4, maybe 3. I prefer grape Kool-Aid, but I've kind of got on a health kick now, so I went to the grape juice instead of the Kool-Aid. And I pour me a nice glass of Kool-Aid like that. And then I go into and I get an Oreo cookie. So I suggest you have a whole pack of Oreo cookies, and you dip it into the grape juice like this, and you let it soak in really well, and then you can snack on. It's a taste that you will never forget. This is my favorite. When I was sick, this is all I ate, and it's nutritious, it's good for you, it builds bodies 12 ways, it's a wonderful drink. The next thing is for follow-up and dessert, since it's happy hour. I have a nice cheese plate here for you that I have prepared with different selections of cheese. And I have right here some ice. And I brought with me a bottle of gin made from Brush Creek up in Saratoga. And so we're just gonna make a little beverage here for our liking. I even got some wines, and we're gonna have just a little bit of gin and tonic to refresh us as we go. So that is how I make my happy hour. So I hope that all of you have something to share with that, and we are going to get started with that. I expect feedback on the grape juice and Oreos because it'll be something you'll never forget in your life. So with that, it's really hard because I've already been asking any questions on that or anything. So you're going to hear me say that over and over and over, but I'll try to get used to it. Sometimes I'll make stuff up and just point to things and ask a question myself. So what Travis and I and MJ talked about is trying to do a dystocia talk and not just do a computer thing, but actually bring something and try to introduce you. A lot of you have been doing calving for years and years and years. So it's only the little things that I'm going to try to express to you to maybe give you one tidbit that will help you in a certain circumstance or a situation that might give you a viable calf. And when we go back, so the way I want to start this is this. One, I want to just point it out right away before we get into it so I don't forget this. With this drought that is coming, and that we have already been through, and the snow and the drought grasses that we've done, one of the things that we need to consider when this upcoming calving season is coming is I think that we, and it's my personal opinion, right, is that we're going to be experiencing vitamin A and vitamin E deficiencies in our cows. Their intake is decreased. I've seen vitamin E and vitamin A deficiencies get more and more significant. So one of the things I think that you should be aware of that is not a bad idea this year to give your cows, your pregnant cows, vitamin A and vitamin D and vitamin E for sure. I think that that's going to help you with calf viability. And even if you can't get to them now, if you've already started, be aware that if you have a slow-doing calf, a calf that's not nursing, a calf that's sick, make sure you either check your vitamin E or you give a vitamin E shot. So I wanted to plug that out because that's what I'm already seeing right now. I've actually seen adults that are dying of vitamin E deficiency, which is really rare. So that's my plug for that, just as a reminder to you. So when we go back, I just want to remind you and go through a couple different things like, how does this whole birthing situation start? Here's Miss Cow, and she's wandering around, and here's Miss Heifer. She's wandering around with this calf inside of her. What actually starts the birthing process? And I still go back and think about this all the time and go, this is amazing to me. So here they are roaming around in a pasture, wherever that may be. The calf undergoes some type of stress factor. That stress factor in normality is that they outgrow their oxygen supply that their dam can give to them. In other words, that baby in there has gotten so big, it's increasing its demand for oxygen. When that oxygen demand is not met, then the baby gets stressed and starts to produce cortisol, just like you and I would. One of the take-home things you could do tonight is if you want to feel what that baby feels like, just hold your nose and go hypoxic. See how long you can do that. Do not breathe, do not breathe. When you pass out, you will breathe, so it's a safe thing to do at home, but you will actually see what that baby is actually going through. When that happens, the baby becomes stressed, cortisol levels rise, and therefore estrogen levels rise. And when that happens, progesterone drops off. So why do I tell you all that? Is because that's what initiates the birthing process. Okay, that stress of the baby. But what happens if you're a high altitude rancher and you already live in a hypoxic condition, right? And here the baby is growing in there. It's supposed to reach a certain size before it gets stressed. But if you're already in elevation, that's too much, right? And so the baby's going to come early. If the baby gets sick, if it gets IVR, VVD, anything like that that causes stress, you're going to initiate that. And we hope it's at the right gestational period. And if it's not, then you get your abortion. Hopefully that makes sense. So I would normally look at you and say, do you have any questions? But I won't do that. So that's what I want you to think about. The next step is we're going to initiate this calving process. And I know, and here's what I'm going to really, really ask of you. And I just went through this with the animal science people here. You need to listen to what that cow is telling you. You need to get your little red books that you have. And I don't want to go into astronomically big detail, but this is the guidelines I want you to have this year. I want you to just try it. And here's what it is, stage one. Do I really care if we memorize? It's called stage one. For tonight, I do. And here's the reason why. Because when you're out there and you're looking at your cows, you're looking at your heifers, stage one of parturition or labor is this. Stage one is when the cervix has started to dilate. That calf has undergone that stress. It is initiated the labor, right? So stage one, you see the cow wander off by itself. The tail goes up. She acts uncomfortable. She lays down. She gets up. Here is your assignment. You now pick out your book and you look out there and you say, oh, look, cow 424 is in stage one labor at 4 p.m. tonight. Because after tonight, you're going to learn guidelines from that, and you need to stick with the guidelines. My goal for tonight is that you will never again go, I wonder if I should get her in or check her. I wonder if she's doing okay. I'm going to give her 2 more hours and then I will check her. That train of thought is out because you're going to have guidelines that tell you what to do. So stage one, all of that. Stage one in a normal animal, in a heifer, could go to 6 hours, the end. That's it. So if you get to 6 hours, you're already late. So in a cow, that stage one is like 1 hour, maybe 2. In a heifer, once it hits 4 hours, I'm done. Let's just say at 4 o'clock, my heifer went into stage one. At 4 o'clock, and at 6 o'clock, if she's not progressing, I'm done. I'm getting her in because I know at a 6 hour period, that calf's going to be really stressed. Okay? So stage one labor, there's no questions asked. If they don't fit that time frame, you go get them in. Stage one is the colicky acting thing. Here comes stage two. Stage two is that part of labor when you see the water bag or the baby's head coming out. This is Homer, by the way, and Homer will be in the show a lot. If you start to see this nose or the water bag that surrounds Homer, that is the beginning of stage two. Why is that so important? Because stage two at the maximum lasts 2 hours. In other words, once you see the amnion or the water bag or a fetal part, whatever it is, that calf should be out laying on the ground breathing in 2 hours. That doesn't mean you start pulling it after 2 hours because then you're way behind, right? So when you see stage two, you're going to write down, oh, that cow 424 is now in stage two at 6 p.m. So I should have a baby on the ground trying to get up by 8 o'clock. And I'm going to plan ahead because if it's not happening, you get 30 minutes to manipulate and then you still have to be able to have the baby on the ground in 2 hours. I hope that makes sense. This is where I would go question. Yes, I have a question over here from Mr. Table. So Mr. Table is asking me, when do I intervene? And that's the question, right? I'm not going to jump to it, but I'm going to watch my timing and I'm going to say, once you see the head, the foot, the amnion, progression should continue. I will give the heifer maybe an hour. A cow normally has the baby on the ground in 30 minutes or so. So those are the guidelines that I gave you on this sheet. I actually printed them in that handout I gave you, and then I just made a summary sheet that you can hang in your barn. It gives you the guidelines. Cows, the heifer, stage two, average is 1 hour. So you've got to interact on that. And we're going to talk about interaction, how to do all that and everything like that. Stage three is nothing more than passing the placenta, right? This is a pet peeve of mine as well. So remember, once the calf hits the ground up nursing, that cow has to get rid of that placenta in 12 hours. Every 12 hours after 12 hours, it's going to delay breedback period up to a week. So in a short period of time, 2 or 3 days of the retained placenta, you're probably going to miss that first cycle on her if you breed back in 42 plus days. So also, and I'm going to say it now so I don't forget it because it just drives me batty. Remember, you do not want that cow to eat that placenta. There is nothing nutritional about that. It actually does nothing for the cow. Remember, if you've all picked one up, it weighs, I don't even know how much. I can't even pick them up anymore. I have to get a jack to pick them up. But it's heavy. It's collagen. Remember, if you and I ate them, God forbid that, if you had a piece of placenta, our acidic stomach would digest that. But remember, it's going to go into the rumen, all of it. The rumen is a pH of 7.5 to 8. It's not going to deteriorate that. It's not going to break that placenta down. The placenta virtually has to rot. So you have to go around and pick up the placentas and gather them. Remember how big and heavy they are. They're going to occupy ruminal space so the cow can't or the heifer can't eat enough food to produce high quality of milk. And I have done numerous necropsies on post calving death. I don't know, my cow died after she had the baby. First place I do is open the mouth and I pull out the placenta because they suffocated. They eat that placenta because of predator control. Hopefully you and your dogs and you and your family are predator control. Pull that. Can you tell that bothers me? Even thinking about it kind of makes me nauseous. So don't let them eat it. I will throw up. Okay. So with all that, what I want to go into and remind you of a couple different things is if you ever have to intervene, which is why we're going to talk a little bit about that. If you have to intervene, if you touch the baby, then you have to treat the baby and treat the mother. Most of the time, I want you to be treating the mother. So if this is a dystocia or my time frame has gone too far, I want you to remember, if I touch it, I am going to treat it. Okay, and I'm going to go through treatment of that mother as we go. But some of the things I want to remind you about. If you're in, when do you make that decision to intervene? Okay, we've already gone on the time frame. Okay, if the time frame isn't working and you're past the time frame, then you're going to intervene. The other thing is if you're in stage 1, and here's an important thing I still see it last week, is that I get a call and they say, I think my cow was in stage 1. And for 2 hours it acted colicky, it got up, it got down, but now what's happening is the animal's acting normal. She's back up to the feed pump, she's eating, she's drinking. I think she had a false pregnancy or false labor. Cattle don't do that. They don't want to play that game with us. So if you see that, and all of a sudden it goes away and she's acting normal, you got to go intervene, okay? The baby's in trouble, mom's in trouble. And so remember, as this comes up and stage 2 is going, this nose of this baby goes into the cervix like this. And as it goes into the cervix begins to dilate, and that produces oxytocin. Oxytocin produces the contractions, and the whole cycle goes. But what would happen? So it's very, very important that this baby is coming out like this. I'm going to load him up right here like this. Yeah. Like this. And he's coming out, and you can see the cervix coming out here. Like this. This baby's coming out, dilating the cervix, causing the oxytocin release, and that makes the labor consistent. What would happen if we have even a backwards calf or a breech calf in which the butt can't get into the cervix? So stage 1 will start, the butt can't get into the cervix can't dilate, it can't produce oxytocin, stage 1 is going to quit. That is why breech babies have such poor survival, is because they've gone through stage 1 way, way, way too long. Okay, so if you see that and everything goes away because they're going to start, going to go away, get them in. The other thing is if the baby's coming like this and you have a uterine torsion, all of a sudden the cervix can't open. So what happens? Stage 1 happens, stage 1 goes away, goes through the next day, the cow's acting fine, then the cow's not doing well because the baby died in utero. So those are reasons to intervene. Going back to the guidelines that you have on your sheet, is when the guidelines aren't met, you intervene. And now you kind of understand what has to take place and why malpositioning that we're going to talk about is so important to diagnose early and do it. Okay? Stage 2, you see the foot, you see the nose, you see the amnion, you're marking your clock going, okay, 2 hours, I need to have Homer on the ground, breathing, drinking, and acting fine, right? So time's going, you're remembering that if I have to intervene, I only get 30 minutes, and in 30 minutes, I better have the baby on the ground, so you don't want to wait for 2 hours. You want to start intervening. If we have not progressed over an hour to an hour and a half, you should have the cow in or the heifer in and intervening with that. So that's a stage 2 timeline. The other thing is if you ever see placenta coming out first, if you ever see gross blood coming out, any abnormality that you see, you need to get on that. Anything that is funny looking, funny fishing, anything like that, you need to intervene on stage 2. And now we already talked about stage 3. So hopefully that made sense on when to start intervening with that. So the next topic, well, I think maybe I'm talking too slow. I think I better speed up a little bit. So the next thing we're going to talk about is you have diagnosed one of these abnormalities that you really want to go for and you want to look at. you're looking at this one of the things I want to bring up right away is that if you see a baby, because all of us don't want to intervene early, we all want to make sure that we allow them to have it on their own. We don't intervene too early. One of the big things that I see over and over, and even when I used to drive to the farm, the baby's stuck in the canal, blah, blah, blah. If you see, how many of you, I'm going to ask a question, I expect to see you in the audience, have seen the baby with the swollen tongue? Okay, we've all seen the baby with the swollen tongue. If you see even a minor swollen tongue, you need to get on that animal immediately. You need to know if you can pull that animal, if you need to push it back in and have a C-section done. Remember that the tongue is one of the last things that swells. Okay, so if you have tongue swelling, you have kidney swelling, lung swelling, heart swelling. If you get pulmonary edema, that baby will not survive. If it does survive, it's going to die at brisket if you live in high elevation. Okay, if it's a breech baby and you miss stage 1, it's going to start aspirating, and you're going to have a high altitude disease animal, or you're going to have a poor pulmonary immune system. So all those things are going wrong, all because you missed your time frame. The tongue thing is something I just wanted to make sure that we got out before I forgot to talk about that. So one of the big things too is that we work on them, and we pull them, and we got breaches, we got all that. Before we decide to put pressure on that animal and take it out of the uterus in there, we need to know if that baby's going to come out. I have stood behind cows many, many times for 19, 20, 30 years, whatever it has been now, going, I wonder if I can truly pull this baby. Okay, and I wonder that. So I'm going to give you guidelines to do that. You've already decided you need help with this animal. So I'm going to put this Homer back into his pelvis here, like this. And we have a normal presentation, one that you hope you see on every animal right here. So you see Homer, he's out looking around, and you're going, it's a tight fit. Stage 2 has been going on because I can see him. Okay, so I know I'm going to have to give some assistance because I only have 15 minutes to get this baby out on the ground. So I need to know, one, if I can pull it without getting hip locked. I need to know if I can pull it without breaking a leg. I need to know all of that. So that's what I'm going to do. And so what I do is I'm going to lube him up. And I tend to use, before I do that, I'm going to back up. And remember, I'm going to touch this baby. So I'm going to get me a bucket like this, and I'm going to put warm water in it. I'm going to come over here, and I'm going to get betadine solution. Okay, betadine solution. And I'm going to pour it into my warm water, look, like that. And I have a nice warm betadine solution colored tea. You don't have to measure, just make it a nice tea color that you would drink. And then I'm going to go and I'm going to get my betadine scrub. This has soap in it. I'm going to put it into my hands, and I'm going to wash up astronomically well. And I'm going to use the scrub to wash up. I'm bare armed. I tend to do bare arms more than I do gloves. I lose the gloves inside. Okay, I go into there and then I can't find my gloves. So I quit using gloves, but I scrub. I scrub with the betadine scrub. These are the products that I really have good luck with. Plus, the betadine scrub will even act as a lubricant. So I'm going to go in, I'm going to scrub, and then I'm going to go in, and I'm just going to fill this baby like this, and then I'm going to find his fetlocks. As I find those fetlocks, I'm going to take my chains, and I know this is repetitive, and I know that you all do this. I prefer metal, but I'm going to take this, and I've got my loop through. I'm going to go above the fetlock, pull it tight, and then I'm going to half hitch it like this. And I'm going to go below the fetlock on my half hitch, like this. And the most important thing is you look at it, see where my chain is coming out. Here is the left foot, here is the right. It's coming out right in between them. It's not over here on the outside. It's coming straight down the leg like this. Hopefully you can see that. Nice and equal. If you do this, it's really difficult to break the leg. And I don't care how long it takes you to do that. That's why you started early. You need to chain like this. You need to take a deep breath, and you need to chain like this and put it on just exactly like that. Both legs. I tend to use 2 chains. You can use one if you want, but make sure that this chain is coming out like this, because when you torque, it's going to keep the leg straight. So I'm going to chain up like that, like on Homer. So I'm going to take my loop it in like this. I'm going to put on Homer's fetlock because I've got it worked there. I'm going to half hinge it. I'm going to pull right in between him so it's coming out like this. And I'm going to work on him. I'm going to go in with my betadine clean hands. And now I'm going to get some OB lube right here. And I'm going to put it all over. And I might even squirt some in there or get a syringe and squirt it in there. And I'm going to lube up his shoulders like this. And I'm going to work him out. I am not going to try to pull this animal out of this canal until both of my fetlocks are beyond the vulva 5 inches. And I'm going to work him slow. I'm going to pull one leg and pull one leg, pull one leg, pull one leg. Lube some more, wash some more lube. Once my fetlocks are out beyond the vulva 5 inches, I know his shoulders are through the pelvic canal. Now I can either get on my puller, I can go get help from my friends, I can do whatever, because now I can start to apply manual pressure to this animal. Once I meet this criteria, then I know that I can pull this animal safely and not break the legs, not get in hip lock, then I can put on my mechanical pullers or get help to do that. I tend to try 2 to 3 people first, and it's important to remember that if it's a frontward presentation like this, you're going to walk this animal out like this. Right leg, left leg, right leg, left leg, right leg, and you're going to make him walk out of that canal. You can't pull him both because then both shoulders just jam into the pelvic canal. Really important. And I feel bad that I know that most of you know this, but try to pick up one tidbit. Once I know that I can get him out, because my fetlocks are out 5 inches, then I like to go to J-lube. I don't ever use J-lube until my criteria are met. Once my criteria are met, I'm going to J-lube the bejeebers out of this guy. If you're not falling down in your lube, you're not using enough. Okay? I've even had people calling me and go, I don't have any lube, what should I use? I have had them dip into Crisco and put Crisco on them. Okay, but if the lube, you should have a pond of lube when you're done. And that's how much you cannot use too much lube. Use the J-lube after your criteria is met. He's out 5 inches. I'm going to walk him out. And once I get him out and he's beyond like this, let him rest for a minute. Remember, a cow in normal labor in stage 2 will push for 2 to 3 minutes, stop. Rest a little bit, rest for 2 to 3 minutes, then start pushing again. You don't want to intervene. Once this baby's out, get it cleaned up, wipe him off, get his nose open, let him breathe, get him going like this. His chest is out. You don't have to go and throw him across to the neighbors. Just let it take your time in a frontward presentation. So once I get him to this point, then even in frontwards, I'm going to reach over and grab the opposite leg like this, and I'm going to rotate this little guy. Because I'm letting him breathe. I'm talking to him. I'm naming him. I'm doing whatever it's taking. But I'm going to rotate him like this. And then I've got my chains on. I'm going to pull. Look how easy he came out of there when I rotated him. Rotated. Here's the reason why I rotate. When we look at this pelvis, and you're looking, here comes the baby out like this, and it's coming out here. The biggest diameter of this pelvis is diagonal. So when I get into that tight spot, I'm going to rotate him so the shoulders are like this. If I'm here, bam, bam, bam. If I rotate, whoop, comes right out. Always rotate every one of them. Doesn't matter if he's coming out fast or coming out slow, rotate them. So then we're going to talk about backwards calves for a minute, because those are just as important, because you cannot be pulling on a backwards calf until you know that he can come out of there. So let's put him back in here. And this is just going to be a backwards look, right? Or is it? So I know you've all been in this situation, because I have as well. And I'm going, wow, I got 2 feet. Stage 2, I saw these 2 feet 2 hours ago. I remember that talk that tells me I'm now 2 hours behind, or I'm an hour behind, so I got to get with the program. Here's my baby stuck in there. Now, do I have front feet or back feet? So if it's back feet, Yes, most of the time they're upside down, right? And you can go, oh yeah, I'm seeing a backwards calf because the foot's upside down. I have seen frontwards calves with their feet upside down. What happened? Uterine torsion midway through, or the calf rotated. That is a mess, right? So what I try to do is I try to go and find, okay, here's that lock, and here's my hock. I'm going to go in and find my hock, and now I go, now I've got a backwards. If I have a frontward, I'm going to find and I'm going to find the knee, and I'm going to bend the knee. If I've ever been able to play with you during your calving process, you will see me do this because I'm male. So I have, once would be sufficient in most people's lives, not mine. I have to sit there like this for 5 minutes going knee, 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 got it. Because you don't want to know that it's backwards or frontwards. You've got to really work that and decide what you got. So backwards calves, same thing with a little bit different things to keep in mind. Same thing, I got my feet. I'm going to chain the exact same way that I did the front. I'm not going to do any pulling. I'm not going to do anything. I've washed up again. And to remind you, I'm washing the cow really, really thoroughly. This thing is sparkling clean. I can see my reflection in it. It's so clean. It has to be clean. And remember, I touched it. I'm going to treat it when we're done. Right? So I'm cleaning it all up. I got 2 back feet. And lo and behold, I can go in there and I can fill my hocks. And I'm going, yep, I got 2 back feet. I'm going to get my betadine scrub. I'm going to get my OB sterile lube. And I'm going to lube up. And I'm going to go in and I'm going to work this baby out as best I can. And I'm not going to do anything except for by myself to figure out if this baby, if I can get the fetlocks out again 5 inches beyond the pelvis. Because we all worry about hip lock, right? We all worry about that. I worry about it. Everybody worries about it. If I can get my fetlocks out 5 inches, those hips are already in the pelvic canal. So what do you think I should do? Okay, I have them out. I know I can pull this baby because the criteria says I can. So I'm going to lube up with some more J-lube, and maybe I'll even put some more of this in because I want this thing to come flying out and knock me down. So, but the first thing, lube up, and what am I going to do? I'm going to rotate. Really, really, really important to rotate a backwards baby because you're actually rotating the hips within the canal right now. So you got to rotate them. The difference between front and back. Remember, front, you walk out. Back, you don't walk out. When you don't walk them, you start to pull on them. If it's a backwards calf, well, I knocked the tail off. Oops. None of you saw the tail fall off my cow. So I'm going to walk this out on the front and the back. I'm going to pull straight out like this. Remember, in a backwards calf, that's why I lubed up before I started pulling, that once the tail exits the vulva, or I can see my tail outside of the vulva, this baby's got to come out now. You cannot take the break like you did up there. You see the tail, you best have your mechanical pullers on, you best have people helping you there, and you need to get that baby out. Because once the tail is out, the umbilicus is cut off, oxygen supply to this baby is gone. It would only take a few seconds when that umbilicus is cut off for that baby to gasp, like that. Sorry, and it's gonna suck in all that amniotic fluid. Does that hurt them? Absolutely it does. Because that amniotic fluid is now contaminated because you have been in there, you touched it. It also goes to the bottom part of the lung, consolidates the lung. If you live in high altitude, you got a brisket calf or a poor immune system, poor pulmonary immune system. Everyone knows that that first few breaths of air develop your pulmonary immune system. If it's crap, your whole baby's life can be that way. That's neonatal care, is dystocia, to get them out. I hope that made sense about the backwards calf because that is so important. Tail out, get the baby out. So what about the breech? Okay, let's talk about that really quick. So now we've got this situation. We have a breech baby and we've diagnosed it. Remember, you know how we found the breech baby? Because we were looking at stage 1. Stage 1 went really good for an hour and a half. And then my heifer went back up to the feed bump, started eating and drinking and acting normal. And usually I used to go last year, I would say, well, I'm going to give her the day and see what she does. Now you're going, Now, once stage 1 starts, hour and a half into it, if it goes back to normal, get the cow in. You can always turn her back out if everything looks good. But when I went to get her, I went in and I found the cervix that had only been dilated that far. If I looked in there like this, I could see the amnion, the water bag, and there's no progression to labor because we have a breech baby and we have no Ferguson response or cervical dilation. So I go, wow, this baby is breech. So now what am I going to do? So to correct these, we'll just go into correction a little bit. I'm going, wow, I have to somehow take this animal and push it back in, right? I've got to push this baby back in so I can manipulate the legs and get it out. So that's what I'm going to try to do here. I'm going to take my hands and I'm going to push it back in. And I'm going to, in an ideal world, it'll slide, fall in. I can reach in, grab one leg, grab the other leg, rotate, and pull my baby out. See how easy that was? Some of them are like this. I want to show you this one more time. We have breech baby. We're already pushing time frame. We have to do something. Immediately should come to your mind, maybe I should just do a C-section. I'll call my veterinarian, then you're out, who knows how long when they get there. But as long as breech baby hasn't exited or the tail is not visible, we still have oxygen. So you can leave them alone, you can try to push it in. What I have run into many times with breech babies, and sometimes even with backwards babies, or unfortunately with the dead baby, is you start to push it back in, and the uterus is so tight that you can't move this baby. You try, doesn't work. Try again, In fact, the more you push, the more she pushes, because that's Ferguson response. When I'm pushing on it, it's stretching the cervix a little bit, which causes her to push. Now I can't do any more. That baby is stuck in there. So one of the things you might try with that, if you have management that keeps you from getting 150-pound calves or whatever, you know your chances are if you can correct the breech, I can pull this baby. So what I suggest that you do is that you carry some epinephrine with you, or you have some epinephrine, okay? Because you can use this in a lot of different ways. It just happens to be the way that I use it a lot is breech babies or dead babies, unfortunately. I'm going to give this cow 1 cc of epinephrine per 100 pounds IV. If you're not comfortable with IV, or she's in a situation where you don't get IV access, give it IM. When you do that, okay, I can't do it. I'm going to give this baby, I'm going to give this mother 1 cc per 100 pounds of epinephrine. So I got it. I can't get to her head because I got her tied to the bumper of my car. So I'm going to go up to quality assurance and get this in the triceps. Unfortunately, it looks better, or the neck, but it's going to go deep IM. Get back here, put pressure on this baby, give it about 30 seconds, and the epinephrine blocks the uterine smooth muscle. So all of a sudden the uterus is like this, you get the epinephrine and does this. And now watch what happens. I'm giving it, I've got 28, 29, one finger, and I push that hammer right back into the canal. Then when he goes in there, I can then manipulate him out. I have my fetlocks out, I can rotate, and out comes the baby, like that. I hope that makes sense. It's an astronomically good tool to have with dystocias. Here is the drawback of that. If you give that, remember the uterus is flaccid now. It has lost its tone, it's lost its pushing ability. So you have to be aware of that they can have a uterine prolapse. So I'll stick with them, I'll feed them, I'll take care of them, everything like that. I will treat that. And I'll just watch it. If I think she's straining a little too much, then I might even sew her shut, or I might put some warm betadine into the uterus to weight it down and hold it. I'm going to watch it and not just blow it off because I gave the epinephrine. It's a wonderful thing to do. The other drug I like to have on hand always is Dopram. If I'm ever doing a dystocia or any kind of cap work, I take Dopram or Doxapram and I stick it in my pocket with a syringe. It's a 3 ml syringe with a needle on it. If I get a baby out and it is not breathing, or it's having a hard time breathing, or by gosh, it's even dead, then I'm going to go to doxapram immediately. And I'm going to give this animal 2 cc's of this under the tongue. This is a respiratory stimulant. When you give it, it's going to be absorbed under the tongue, sublingual, and it's going to cause the baby to go like that. And that's sometimes all it takes to get things going. Okay? If the baby is dead and you got no heart, you got no lungs, you got no nothing, I would go with the CCIV and 2 cc's under the tongue. It's an astronomically good drug. Academically, people don't use it sometimes in the academic world because, and they are correct, by all means they are correct. When you do that, it's going to use up glucose supplies to increase respiratory rate. And as respiratory rate increases, glucose is absorbed, the heart rate increases, and you're burning up needed glucose to survive. But here's the way that I look at it out of my weird mind is it doesn't really matter, because if your glucose is used up, you're not going to use any more glucose if you're dead. So I would rather burn my glucose and take a chance of survival with this drug than worry about that. So hopefully that makes sense. I use the drug all the time, and it's quite effective. It is quite effective. So we've kind of done all those. I mean, this talk could go hours, right? You can kind of see that if we went through every correction, everything like that, it would take hours. And honestly, you all know me well enough, I could stand up here for hours and jabber at you. One of the other tools that I use a lot, I'm going to push this baby back into breech like this, because I need to be able to, if I'm pushing and trying to manipulate, it gets me into trouble. I can't do it. So one of the most expensive tools I carry is a plunger like this, and I will clean it up with my betadine scrub, dip it in my betadine bucket, and I have all this like that. And what I do with this plunger is I put it on his butt like this against my chest, and I just push into him like this, and I saw the handle off a little bit, and then I'm able to push him back in as I manipulate the feet. Because this way I can continue to give slow, steady pressure, and I can grab his feet with my free hands now because I have this on there. And during calving seasons in Gunnison, I walked around most of the time with little, small, round bruises all over my chest. It was actually made me feel like really manly, so I didn't mind them. So I wanted to talk to you about that one fine tool. I'm just kind of making sure I went through everything that I wanted to. One of the big things that I would encourage you to do, if you can, as far as neonatal care, once you get the baby out, we talked about Dopram, we talked about all the other things. One of the things I would really encourage you to do, if at all possible, is to get an oxygen tank set up. You could use acetylene oxygen. You can go and you can buy regulators, just anything you can. Put an O2 tank in your barn where you do your babies and your calving and all that. If you have a baby come out, remember when they come out, you pick them up because you used enough lube and squirted out, and now you put them sternal. You always keep the baby sternal. I like to tuck their legs under them like this, and I keep them just like this. Never, ever like that, because that bottom lung is going to fill up with amniotic fluid, so they're always like this, okay? You brush them up. It's always a wonderful, terrific idea, because then you have oxygen over here. You take your oxygen mask, you clean them up, you make sure you tickle their nose, you do their mouth thing, clean up their mouth, get your oxygen mask, put them on them, and let them breathe oxygen, even if it's for a minute. If you can go 3 to 5 minutes, it's wonderful. Remember, all the things in utero shut down to give you real life in the presence of oxygen, especially if you're in high elevation. High elevation is 5,000 to 6,000 feet and up. Give them some oxygen. It always amazed me. I could listen to a baby's heart, and I still hear the fetal circulation in the baby's heart because there is no oxygen or enough oxygen to close those down. Those close in the presence of oxygen. So get your tank on them. Let them breathe. Remember, they have to have oxygen to start to build their own immune system in their lungs. I think we're negligent in that way. I think we're not giving the baby the best opportunity to build their own pulmonary immune system because they're hypoxic. So get the oxygen on there. It might cost you $50 to buy a regulator and an O2 tank, maybe 100, but I doubt it. Get it on there, and you don't have to do it for hours. Get them on the ground, let mom settle down, put this on the baby and give him some oxygen. So as we finish up here to go to questions, remember we touched her, we pulled her, we had her arms in, you have to treat mom. Okay, my treatment of mom consists of this. We need antibiotics on board. We touched it, right? So we're going to start, you can do the antibiotic of your choice, okay? I don't care which one it is, whatever you're comfortable with. You need pain control, okay? I always give them IV Banamine. You were in there, you messed around. You got to give them pain control. If the mother cow is painful, she can't produce milk, okay? Her colostrum is going to go to crap. Give pain control, give Banamine. The next thing is inside of her uterus, I like to give oxytetracycline 100, so it's 100 milligrams per mil, and I'm going to draw up and I'm going to give them 60 cc's of oxytetracycline in the uterus, like that, as far in as I can go. Because remember, you pull the baby, you're going in to palpate for another baby. Okay, you're going to make sure that the uterus is clean. You're in there, you're palpating for it. I'm going to infuse 60 cc's of oxytetracycline. If all you have is LA200, give them 30 mils. Okay. So the next thing I'm going to do is I'm going to give them a cc of oxytocin to try to help pull that out, and I'm going to give them Ludolase. I'm going to give them some prostaglandin product that I can help break down and release that placenta. If you can get Ludolase into them within an hour after calving, so you should be getting it in 15 minutes after calving, it's going to help release that placenta and get it out of there. And you're not going to let the cow eat it anymore anyway. And you're going to carry that away and throw it in the ditch. Right? So I'm looking at my clock and it's 6:15. We've enjoyed our happy hour. I'm going to stop there. And we're going to see if Travis or MJ have any questions from you guys that I can help you with as we end this up.
Well, Dr. Holt, I really appreciate everything that you did. And that is a lot of information. Like you said, we can go over that time and time again. And I really think that you have covered quite a bit of ground here in a short period of time. And happy hour is not enough to do calving seminar from where I'm sitting. So I'm going to do something right now for everyone. I am going to paste a poll link in the chat, if it will let me. There's the link to our form, so please fill that out. You can click on it, go to that, fill it out, and then we'll get some feedback so Dr. Holt, MJ, and I know whether this is a practical thing to do for you guys, so we appreciate it. With that being said, we've got a couple questions. Okay. I'm going to start off with one that I've had experience with, and you said vitamin A is important. Probably this year with the drought, vitamin A and E. A few years ago, we gave that to some cows. What dosage would you recommend those cows need if it's injectable?
Yes, that's a great question, Travis. And the best way to answer that is kind of a cop-out because there's different projects with different concentration. And this is a product, vitamin A, vitamin E, Vitally is a great, great product. You just go by the dose that's on the bottle. Because that dose is going to be right there on the bottle for you according to the milligrams that are there, and they will guide you. I have picked up every one that I can, and I follow those guidelines really well. So instead of giving you one that's good for this one or not so good for that one, read the bottle on vitamin A and E and D, or vitamin E, and you will be set to go with that.
Now, the reason I asked that, Dr. Holt, is we did give it according to regulations.
Yep.
The bottle said 10 cc's per head.
Okay.
And we actually aborted some calves with that, with an AD&E product.
That I don't know. I have not heard of that before.
Okay, and I've talked to the company and it's not unusual. They've had several cases of that. So I think it may be something to consult your veterinarian about an actual dosage. That's why I was wondering what you recommended.
Yeah, so I'll give you my bias. How's that?
Okay.
My bias is that we use a vitamin E shot and skip out the A. because vitamin E is hard to overdose. Yes, it's a fat soluble vitamin, so you can, but the vitamin A, there is reports out there about vitamin A toxicosis causing abortions in weak calves. So I tend to use vitamin E because that's the big one that I see that's a problem. Vitamin A I use after birth if I do think that. In Gunnison, I use vitamin A at 0.5 cc per calf and 1 cc per foal that was born after that. But pre-calving, I stick with the vitamin E shot and go from there. I have not seen or read about vitamin E causing abortion, but vitamin A toxicosis can do that.
Okay, that answers that question. Kind of following up with that, Jeff Myers asked, can a shot of supplement like multi-min meet the deficiency?
I would say that's a really good question, Jeff. I think you're going to meet the deficiency on the mineral side of it, the vitamin side of it. I'm not sure that's going to do it or not. I think if you're giving multi-min regularly and you're doing it pre-calving and the cows and you've treated them before, my guess is you're going to be okay. The things you want to watch for in a vitamin E deficient calf is just okay for a couple of days and crashes and burns. Comes out okay, but doesn't seem to thrive. Okay. Those are vitamin E related issues. They call it, we've always called it white muscle. What that means is they can't use their muscles. So they're lethargic, they lay there. If you're seeing that, then I would start to treat them. But I think if you're treating them with multi-min and you're going on with that, you've done that for a period of time, you're probably okay without supplementing right now. It's one of those things I mentioned just to keep it in the back of your head going, why are my calves slow and droopy this year? Why did this calf die for no unknown reason? Keep vitamin E in mind with that, okay? And then go ahead and do a vitamin E level on that.
Okay, we have another question here from Julia. Have you used meloxicam on mom or baby?
Yes, Julia, I have. I use more meloxicam on the adults than I do the babies. Meloxicam is a good drug in some ways. The research on it is good. The research on it is not so good in some areas. I do use meloxicam. Remember, meloxicam is an oral product, so you have to get it into the cow. So you can use it if you want a prolonged period of time. Banamine we all have. That's why I suggested Banamine. I can give it IV, and I go from there. Meloxicam is good. You can use that. And if you need to know a dose, text me on that, and I'll give it to you. The dose I use on that.
Okay. I was looking here. Ashley asks, do you have any other suggestions specific to calving in the dry drought climate this year?
Yeah, Ashley, it's a great question. And the problem that I have with calving in the dry dust is the baby hitting the ground. So mom's going to take care of herself in most situations. Contamination is going to be bad. Baby's going to get into the dust. And I see it, actually, I'm already seeing the effects of it in southern Colorado. They're being born in the dust. The only thing I can say is to try to get them on grass, try to get them out of the corral when you can, as rapidly as you can, because if they inhale the dirt, inhale the dust, they're inhaling E. coli, Clostridium, fungus, all that things are going to be lung tissue damaging, and you're going to end up with pulmonary disease, pneumonia, brisket, and all that. So yeah, real easy for me to stand up here and say calving ground management, but that's the best tip I can give you.
Erica asks, how many cc's of Lutalize for the cow when you're clearing stage 3?
Yeah, so it's the same dosage you're going to give is 5. And it's real important. I mean, there's controversy on that, but not very much. People are really into that. There used to be a product called Bovaline, and that worked really well. They took that off the market. It's still important to go ahead and try. As soon as the baby's out, you need to start planning for rebreed, right? And the best way to go is that get that cow recycling immediately, get that placenta out of there. Remember, a retained placenta is in 12 hours. So in 13 hours, I'm going to start working on getting that thing out. Okay, so that's why I go ahead and do that.
Okay, Paul asks, if we have scour guarded the cow, we vaccinate the calf with calf guard on top of that.
Okay. Was that a question? Can he or should he, or what was the question?
Yeah, I think that's what he's asking. Cows are scour guarded, so then do we vaccinate calves with calf guard on top?
Yeah, so the way, Paul, I would go about that is this. I'm going to scour guard 3KC, whatever product you do, make sure it has rhodocorona in it, right? So when they're born, the place I use calf guard on top of my vaccine, not routinely. If I have animals that are getting scours and I actually do diagnostic work on them and it comes back rhodocorona or E. coli or whatever, then I might use it. But I'm not going to just routinely use calf guard orally if my cow is vaccinated and I have a good nutritional program and I'm going to get my calf up and get them colostrum. I'm not going to give them calf guard until I diagnose it as a rhodocorona E. coli problem. If I come up with an E. coli problem, then I might go ahead and use a product called Equalizer, which is an E. coli antitoxin. Or if it comes up Clostridial, maybe I'll use an antitoxin for that. But if my cows are vaccinated, I'm going to do diagnostic workup on my calves, which you all know me well enough to know I'm a fanatic on finding out what I'm treating, and then I'll treat that. And not just routinely give that. Paul, I hope that helped.
Paul also asks, what are your feelings, and I believe that he got spell checked here, on biomass supplement?
You may have to expand that one. So there's a lot of supplements out there. One is Cattle Active, the biomass product. I'm not familiar very well with that. The Cattle Active, and I don't know these products, so I'm not working for them or anything. I was pretty skeptical of all those supplemental products. I have seen them be beneficial. So I actually used Cattle Active yesterday on a chronic bloat. So I think those products could all be weighed in. I'm probably not the best one to answer those questions on products like that. I'm looking into doing research right now on an algae product for immune boosting and for inflammatory protection. So if we do this again in a couple of months, I'll have that data for you.
Okay, I hope that helps, Paul. And if you need further clarification, email me. My email comes in on those deals and we'll try to get you some help on that. Todd asks, do you use any antifungal agents to reduce competitive advantage given to fungal pathogens by the use of antibiotics?
No, I'm not. And so now you have to look at the world that I live. I live here in Colorado. I spend my time in the mountains. So that is a really good thought. If we're using antibiotics, we need to be protecting ourselves from fungal. If I'm in Arizona, then I would be considering that. In the world that I live in this area of Colorado, Wyoming, Utah, New Mexico, I just don't see enough of that to be worried about it. I've seen it in dogs before, and I tracked the dogs, and they all were in South Dakota. So to answer that question is I do not, unless I have specific fungal diagnosis, and then I'll go after that.
Okay. Well, Dr. Holt, that exhausted the list of questions that I have here in the chat. I want to thank you very much for all the information, and it was great to see something other than a set of slides done. That was, it was fantastic. So if you guys would scroll back up in the chat, please fill out our poll so we can get some information back. As always, thank you to MJ Fisher for running this Zoom. I hope you guys tune in next week because we have Dr. Matt Spangler, the geneticist from University of Nebraska. He's going to be talking about sorting out the bull, some of the myths and things going on in bull genetics and selection. So with that, we're all going to give you the virtual clap here tonight. Dr. Holt, thank you very much. We appreciate everything that you've done and the time that you have invested in this project. I'm going to say you can get on with your happy hour. And thank everyone. I hope you guys enjoyed this program. As always, it's recorded, and we will post those recordings and get them to everybody that's registered. Thank you guys very much for attending tonight, and thank you, Dr. Holt.
Thank you, guys. Oreos and grape juice. Thank you.